Every hour, dozens of seniors have a heart attack, many alone. It's a silent crisis, often unfolding quietly behind closed doors. The signs are subtle: fatigue, confusion, a sense of isolation. Knowledge in these moments is life-saving. Today, we'll walk through 7 steps. Not just instructions, but a journey of empowerment. This is about transforming fear into foresight and solitude into self-reliance. Let's explore this path together so you can be the calm, capable captain of your own survival. The first step is recognition. It's about tuning into your body's unique language, learning to decipher the subtle cues it sends your way. Think of it as becoming fluent in the language of your own well-being. This isn't always easy, especially as we age and might dismiss certain sensations as just getting older. But it's a crucial skill, one that can potentially save your life. Heart attacks in seniors rarely look like the movies. They often present with a different set of symptoms than what you might expect. The classic image of someone clutching their chest and collapsing is not always the reality, particularly for older adults. Instead of a dramatic collapse, there are often just quiet signals, subtle shifts in your normal state of being. These signals can be easily overlooked or dismissed, but they are important clues that something might be wrong. It's about paying attention to the nuances, the small changes that deviate from your usual baseline. Watch for unusual fatigue, a level of tiredness that goes beyond what you'd expect after a normal day. This isn't just feeling a little tired. It's an overwhelming sense of exhaustion that comes on suddenly or lingers for an extended period. It might manifest as feeling drained even after a full night's sleep, or struggling to complete simple tasks that you usually handle with ease. Be aware of shortness of breath while resting, or with minimal exertion. This is especially important if you haven't experienced this before. It's not just being winded after climbing stairs. It's feeling like you can't catch your breath even when you're sitting still or engaging in light activities. Or a persistent air hunger, that feeling that you can't get enough air no matter how deeply you breathe. It's a distressing sensation that can leave you feeling anxious and uncomfortable. You might find yourself gasping for air or struggling to take a full, satisfying breath. Chest discomfort may feel like pressure or fullness, not sharp pain, a sensation that's often described as an elephant sitting on your chest. It might be a squeezing, tight feeling, or a general sense of heaviness. It's important to remember that heart-related chest pain doesn't always present as a stabbing, acute pain, and can come and go, waxing and waning in intensity. It might disappear for a while, only to return later, perhaps with increased severity. This intermittent nature can make it easy to dismiss, but it's crucial to pay attention to these recurring episodes. Discomfort might spread to your arms, back, neck, a radiating sensation that moves beyond the chest area. This referred pain can be confusing, as it might not immediately be associated with the heart, jaw, or stomach. These seemingly unrelated areas can also be affected by heart-related discomfort. Pain in the jaw, especially on the left side, can be a sign of angina, sometimes mistaken for indigestion, leading to delayed diagnosis and treatment. The discomfort might feel like heartburn or a general upset stomach, making it easy to dismiss as a digestive issue. Other signs: sudden cold sweat, breaking out in a sweat even when you're not hot or exerting yourself. This is often described as a clammy, cold sweat that can leave you feeling weak and shaky. Nausea, a feeling of sickness and the urge to vomit. This can be accompanied by stomach upset and a general feeling of being unwell. Dizziness, a sensation of lightheadedness or feeling like you might faint. This can be caused by a drop in blood pressure or a disruption of blood flow to the brain. Don't rationalize these away as aging or a bad meal. It's easy to attribute these symptoms to other causes, but it's important to consider the possibility of a heart-related issue, especially if you have risk factors such as high blood pressure, high cholesterol, or a family history of heart disease. Trust your intuition. If something feels wrong, pay attention. Your body knows when something isn't right. Listen to that inner voice and don't dismiss your concerns. The quietest symptoms can be the most urgent. Don't underestimate the significance of subtle changes in your health. Sometimes, the most dangerous conditions present with the least obvious signs. Awareness is your first line of defense. By being vigilant and attentive to your body's signals, you can increase your chances of detecting a problem early and seeking timely medical attention. When you're alone, you are your own first responder. In those moments when you're by yourself, you're the only one who can recognize and respond to potential health emergencies. Honor your body's signals. They're your best warning system. Treat your body with respect and listen to what it's telling you. It's a partnership, and your body is constantly communicating its needs. Recognizing these whispers is the foundation for every step that follows. It's the crucial first step towards taking control of your health and well-being, empowering you to make informed decisions and seek the care you need. If you suspect a heart attack, every second is critical. The choices you make in these initial moments can significantly impact the outcome. Recognizing the symptoms and acting swiftly is paramount. Don't hesitate. Don't delay. Trust your instincts. Call 911 immediately. This is not the time to be stoic or to downplay your symptoms. This is the time for decisive action. When you feel that crushing chest pain, that shortness of breath, that overwhelming sense of unease, don't wait to see if it passes. Don't try to diagnose yourself. Reach for the phone and dial those 3 numbers that can connect you to life-saving assistance. Don't call friends or family first. Paramedics bring life-saving care. While your loved ones undoubtedly care about you, they are not equipped to provide the immediate medical attention you need during a heart attack. Paramedics are trained professionals with the knowledge, skills, and equipment to stabilize you and transport you safely to the hospital. They can administer medications, monitor your vital signs, and provide crucial interventions that can make all the difference. Never drive yourself. Your condition could worsen suddenly. The stress and exertion of driving can put additional strain on your heart, potentially exacerbating the situation. You could lose consciousness or experience a sudden cardiac arrest while behind the wheel, putting yourself and others at risk. It's simply not worth the gamble. Emergency services can guide you and start treatment before you reach the hospital. Time is muscle. Every second counts. The 911 operator can provide you with critical instructions over the phone, such as how to administer aspirin or perform CPR if necessary. They can also alert the hospital so that the medical team is prepared for your arrival. The sooner you receive treatment, the less damage will be done to your heart muscle. When you call, say, "I think I'm having a heart attack." Be clear and concise. Don't try to minimize your symptoms or downplay the severity of the situation. The more information you can provide to the 911 operator, the better they can assess your condition and dispatch the appropriate resources. Give your address, speak slowly and clearly, even if you feel panicked. Repeat the address if necessary to ensure they have it correct. Accurate information is crucial for a timely response, and unlock your door if possible. This will allow paramedics to enter your home quickly and easily without having to waste precious time breaking down the door. If you are unable to unlock the door yourself, try to provide instructions to the 911 operator on how to gain entry. This simple preparation saves precious time. Every second counts when it comes to treating a heart attack. By taking these small steps, you can help ensure that paramedics can reach you as quickly as possible and begin administering life-saving treatment. Once help is on the way, you're no longer alone. Knowing that trained professionals are en route to assist you can provide a sense of comfort and reassurance during a frightening experience. Focus on staying calm and following any instructions provided by the 911 operator. Making that call is the most important decision you can make. It's the moment you choose action over denial. It's a moment of courage, a moment of self-preservation. It's the moment you take control of the situation and give yourself the best possible chance of survival. Let professionals take over the fight. They are equipped with the knowledge, skills, and resources to provide you with the best possible care. Trust their expertise and allow them to guide you through this critical situation. Hold on to the knowledge that help is coming. That call could save your life. It's a lifeline, a beacon of hope in a moment of crisis. Remember, you are not alone and help is on the way. Stay strong, stay positive, and focus on your breath. While waiting for help, if you're not allergic and your doctor approves, take aspirin. Aspirin slows blood clot growth, buying time for your heart. Chew 1 full strength, 325 milligrams, or 4 baby, 81 milligrams. Aspirin's chewing works faster than swallowing. This small act can help preserve heart tissue. Sit calmly, chew thoroughly, and swallow. Keep aspirin in an easy-to-reach spot, like your bedside or next to the phone. Preparation turns panic into action. Remember, aspirin isn't a cure, but it's a vital bridge until help arrives. Always check with your doctor about using aspirin in emergencies. This simple step can make a real difference. In a crisis, every small action counts. Your body's position matters while you wait. Don't lie flat. Sit upright in a chair or on the floor with your back supported. Sitting up reduces the heart's workload and makes breathing easier. Gravity helps ease pressure on your heart and lungs. Loosen tight clothing to help you breathe. Avoid walking or pacing. Conserve your energy. Find a position that feels stable and comfortable. This is an active step, not passive waiting. Each adjustment helps your body cope. Support yourself physically and mentally as you wait. Small changes can have a big impact. Panic. It's a natural response to a perceived threat, but in a medical emergency, it can become an enemy. Panic can make a heart attack worse, exacerbating the physical symptoms and making it harder to think clearly. It tightens your chest, quickens your pulse, and floods your mind with fear. But remember, panic is a state of mind, and you have the power to influence it. You have the ability to take control, even when it feels like everything is spiraling. You are not helpless. You can control it with your breath. Your breath is an anchor, a tool, a lifeline in the midst of chaos. It's something you always have with you, a constant you can rely on. By consciously regulating your breathing, you can send signals to your brain that it's safe to calm down, that you're in control. Use the 4-7-8 breathing technique, a simple yet powerful method to regain composure and slow down your racing heart. This technique is designed to shift your focus from the panic to the rhythm of your breath, allowing your body to naturally relax. It's a technique used by professionals in high-stress situations, and it can be your secret weapon too. Begin by exhaling fully, emptying your lungs completely. Release all the stale air, all the tension, all the fear. Imagine you're blowing out a candle, gently and completely. This initial exhale is crucial, as it sets the stage for a deeper, more calming breath. Now, inhale slowly and deeply through your nose for 4 counts. Feel the air filling your lungs, expanding your chest. Let the breath travel all the way down to your abdomen. 1, 2, 3, 4. Hold your breath for 7 counts. This is where the magic happens. As you hold, your body begins to absorb the oxygen, and your heart rate starts to slow. 1, 2, 3, 4, 5, 6, 7. Finally, exhale slowly and completely through your mouth for 8 counts. Release all the air, all the tension. Imagine you're releasing all the negativity with each exhale. 1, 2, 3, 4, 5, 6, 7, 8. Repeat this cycle to calm your mind and slow your heart rate. Do it 4 times, 6 times, as many times as you need. Each repetition will bring you closer to a state of calm, a state of control. Focus on the rhythm and sensation of breathing. Feel the air entering and leaving your body. Let the counting anchor you in the present, grounding you in the here and now. Don't let your mind wander to the what-ifs and the maybes. Stay present, stay focused. Controlled breathing activates your body's natural calming response, the parasympathetic nervous system. This system is responsible for rest and digest, slowing your heart rate, lowering your blood pressure, and relaxing your muscles. Each breath is a victory over fear, a step towards regaining control. With every inhale and exhale, you are actively fighting the panic, reclaiming your power. Continue this pattern as you wait for help. It's a proactive way to manage your anxiety and support your body's natural healing processes. You're not just waiting, you're actively helping your body endure, providing it with the oxygen it needs to function optimally. You are actively participating in your own well-being. Breathing with purpose can steady you in the storm. Use your breath as your anchor, your constant in the face of uncertainty. Calm is your ally, your strength, your inner resource. Breathe for your life. It's the most important thing you can do right now. If you feel you're about to lose consciousness before help arrives, there's one last technique. Cough CPR. Take a deep breath, then cough forcefully and deeply as if clearing your chest. Repeat deep breath, strong cough about every 2 seconds. This can help keep blood flowing to your brain for a short time. It's exhausting and only a temporary measure. Use it only if you feel yourself fading. Don't practice unless it's an emergency. Knowing this gives you one more tool in a desperate moment. It's a final act of self-preservation. Preparation is power, even in the worst-case scenario. Hold on to hope, but keep this knowledge ready. One more breath, one more second. The most empowering step is preparation. Make a heart attack action plan now while you're calm. Write down key symptoms, your address, and call 911 inches in bold. List allergies, medications, and your doctor's contact. Add an emergency contact's name and number. Keep this plan somewhere visible, like your fridge or by the phone. Store chewable aspirin nearby if your doctor approves. This plan turns chaos into order and fear into control. It's a map for you and for paramedics. Preparation is an act of self-care and love. When crisis strikes, you'll have a clear path. You're not a passive victim, you're ready. Peace of mind comes from having a plan. We've covered 7 steps, acts of wisdom and self-preservation. These aren't just instructions, but a way to live with awareness and strength. Preparation is hope, not fear. By learning these steps, you've honored your own resilience. Let this knowledge bring calm, not worry. Live fully, knowing you're ready for whatever comes. Subscribe to Wise Reflection and share this with someone who lives alone.